Good afternoon, and
Good
today
afternoon.
we have a pleasure of interviewing Dr. Lena Sapozhnikov. Good afternoon, doctor.
Good afternoon. Thank you for having me.
And thank you very much to our audience. If you have trouble sleeping or sleep next to snoring partner and you want to find out how the situation can be improved, this program is for you. We're gonna talk about mini implant assistant rapid palatal expansion. So making you breathe through the nose without, let's call it surgical, without orthodontic surgery, just doing orthodontic treatment. We're going to discuss it in more details today, and it's going to make you breathe better through the nose and create more space for the tongue. If you're a medical professional who, just like us, trying to put of puzzles of modern times sleep and breathing disorders together, this program is going to be for you. We're going to talk about this, I would say, very much in style treatment for sleep and breathing disorders, MARPE. And I'm going to talk about Dr. Sapozhnikov. She is very famous doctor in New York, and I heard about her wonderful work for a long time. And she does exactly what I just mentioned about MARPE. She does a mini implant assistant rapid palatal expansion with the help of clear aligners to create beautiful smiles, but in the same time to improve nasal resistance or nasal breathing. And today we're going to talk about that procedure, and Dr. Sapozhnikov takes a lot of courses, so she's a very educated dentist. She took endo courses and photography courses and periodontal courses and rejuvenation. So a lot of courses before she started really doing MARPE. So she has a great foundation. And then, she learned a lot about orthodontics, and my heart belongs to ortho, just like yours. In airway. So that's wonderful what you practice this specialty based on a very solid scientific foundation. So can you tell us how does skeletal expansion with MARPE differ from dental alveolar expansion we usually do with traditional appliance or clear aligners? What exactly happens when you do mini implant assistant rapid palatal expansion?
Right, that's a great question. So clear aligners and braces with wires move the teeth. So if the teeth are tipped in or rotated, we can align them and develop the arch form and make beautiful round arch forms that are functional with these appliances by moving teeth. However, if the bone is constricted and doesn't allow us to move the teeth adequately, it's likely because the bone is too small. So in order to increase the arch form, we have to move the bone. And maxilla is this amazing bone, the only bone in the body that is two almost equal halves that we can separate along the midline junction called the mid-palatal suture. And if we would put pressure on each side of the maxilla, we can move the two parts of the bone apart, and the bone in the middle of that suture is going to start growing. This is a very old principle. This is nothing new, but we can't really do that with any other bone without surgery. And in women, we can do this without surgery into our 80s in most cases. So once that bone is bigger, then we can move the teeth. Let's say we have one tooth that is out of the arch, there's not enough space, we just made more bone and we can safely move the teeth in. Does that answer?
Yes, that's a perfect answer. But talking about that procedure, a lot of people wants to know how long they would be uncomfortable after that, let's call it not surgical procedure, but in the same time, it's, involvement of placement of mini implants in a palate and forces what apply when, patient or doctor, I don't know how, it work in your practice, move the expander. So how long the uncomfortable period lasts?
So everybody is different, but I would say the majority of my patients don't have much discomfort even within the first or second day. especially if the case is done where the mini anchors are placed first and then the appliance is placed after, because there's no tension on the body. So the procedure is done with local anesthetic, and it's just small openings in the palate that are made to place the mini screws. The appliance is fixated, and then the patient is instructed to start turning the next day or the day after, as soon as they feel comfortable, depending on what's going on. And the discomfort from the turning, initially you don't feel much. You feel like a little pressure here, maybe in between the front teeth. But on the day that the suture splits, when you get the little space, you may feel kind of like a lot of pins and needle sensation along the midline, and you will feel it for sometimes the whole day. Some people can get a lot of pressure in this area, but once you expand, that pressure goes away because you've reduced resistance. And the important part is to follow the turning protocol. So while it's called MARPE, rapid palatal expansion, because we're used to that terminology, all of my expansions at this point are done slowly. So I expect patients to slow down the turns. I give them the protocol. And sometimes I have them do loosening turns prior to starting doing the opening turns to loosen all of the junctions so that you don't overload the bones with force. And that creates a much, much more gentle expansion process. Usually they don't feel a lot of discomfort. I'm a patient myself, so I went through this, and because I knew how it was supposed to work, I enjoyed feeling the pressure and knowing that I have this tension between the teeth and pressure in my nose, and it was working, but I didn't have much pain.
That's beautiful what you experienced that yourself. But my question to you, can you talk about the protocol and what does it mean, before moving forward, moving it back, loosening it up? Because some people who are not familiar with that experience and they're listening to our interview and they might think what they want to breathe better with the nose. That's how I look at the MARPE. Like for me, that's the major benefit of MARPE, to get the nose nature designed you to have. So can you talk about your protocol?
So I don't think any specific protocol is known to produce better nasal breathing. It's just a matter of increasing the nasal floor and the nasal volume. I would say 95% of patients breathe better after maxillary expansion, even within the first month, as long as they don't have other things going on with their nose, such as nasal valve collapse, or if they don't have severe allergies, then they may not experience the benefits. Usually the kids do a lot better with expansion just because they're younger and some of the patterns haven't set in. But even adults, I would say 95% of patients breathe a lot better after maxillary expansion.
But my question was about your protocol. So how often patients have to turn the screw to,
Yeah, so my initial protocol is I have patients turn once a day, daily, for 7 days. Usually female patients would get a separation by day 7 or maybe by day 10. I schedule female patients usually 2 weeks later, and male patients, depending on the age, I may have them turn for 7 days, come back to the office, then I would measure the force that is required to make a turn. And if the force is below 500 Newton centimeters that I measure with a gauge, then we're going to continue turning the same way until we get a little space, and I take an x-ray to see if the bone has started splitting. If the male patients who are over 24 or with thicker bone have not gotten a space yet, and the bone, the force measures over 500 Newton centimeters, I have them do what's called the force-controlled polycyclic protocol, where they have to turn back the appliance, meaning close the appliance to relieve the pressure for a period of time, and then about half an hour later, open the appliance, and do that twice a day for a week, come back to the office, and then I remeasure the force it requires to do one turn. So if that, and usually pretty much most of the time, that force will have fallen below, and we can start gradually adding one turn every 2 days. So twice a week, we're going to add a turn, and then at the end of the week, measure again. And that way I can ensure that I'm not overloading the appliance, I'm not overloading the tags, and especially not overloading the bones. So we want to work with the body, not just push to get a space. We want to make sure the split is going to happen. We just have to make it happen in a way that's not harming the patient.
I have a question. What if, let's take a male patient, because, just like you mentioned, female have a more flexibility in life and in the bone. The male patient, doing this release of pressure with turning back, turning forward, but it's still not opening. What course of action you would offer to patients who really need bigger part?
Yeah, so if they have a lot of resistance, and this has happened only with one male patient for me so far, it might happen again, but we need to understand that there may be resistances in other sutures that are connecting the mid case to the base of the skull, like in the cheekbone area and then paranasal area. So if that patient is not going to split, then I like to go to 4 millimeters before we see anything happen or not happen. I would refer them for dome surgery with an ENT or an oral surgeon. And what that surgery is, and it's a very minimally invasive procedure as well, they would do a releasing cut in the bone here and here to release this tension that's preventing the midline from splitting. And then you are going to get a definitive
split.
yeah.
But do you do anything in the suture for people who would like to know what's going to happen with the suture itself to loosen it up?
Well, the suture is going to split. It's just that the resistance in other areas is what's preventing it from happening. For males over 24 with a thicker bone, I normally do a cut in the midline of the palate with a piezo, but that is only through the palate, and the midline is most likely going to split. That is, of course, a point of resistance, but I don't have the surgical means of releasing other areas that will also be of importance, and they will not allow the midline to split because something is not letting it clear. So this may be looser, it's just this that's not letting it happen. And the other thing, we might get into it later, but doing some body work to release fascial tension could be extremely beneficial in allowing expansion to happen in a much smoother way for patients, because there's a lot of tissue resistance. And in patients with clenchers, we may experience more difficulty splitting just because there's just so much tension in the system overall. We can't just look, oh, this is the palate and we're splitting the palate. It's attached to the rest of the skull and the tissues.
This is such a beautiful topic of a conversation, and I like to talk about that on my podcast or in my book, how head actually connected with the rest of the body. And because in my, let's call it network or referral network or collaborative network, there are a lot of physical therapists, PRI trained, osteopaths, and craniosacral therapists, and they, MARPE become very popular. They have their own voice regarding MARPE. In their explanation, and that's what we discussed before this interview, they feel what deviated septum is the sign of tension in the body somewhere. Crowded teeth or crooked teeth, how people call it, it's also sign. It's a sign of, certain tension, certain asymmetry, certain pressure area, we would put it this way. So my first question to you, that being said, but this is, so much asymmetry for people who have MARPE, what's your protocol to prevent asymmetrical MARPE from happening?
Yeah, that's patients are actually really educated on the potential for asymmetry, and that question comes up a lot. So there is a lot to unpack here. it's a chicken and an egg sort of question. Did the tension in the system cause the deviated septum, or is the tension in the system and the deviated septum and the misaligned teeth the consequence of the jaws not having developed enough, and then the body, the person struggling to breathe, struggling to function because the structure is too small, and then downstream everything else becomes tense because it just can't properly function. So let's go with the idea that the structure didn't develop properly, and then we have a deviated septum, we have crowding, and we have tension in the fascia because the body is trying to struggle with the structure that it was given, not the structure that it's supposed to have. So the septum is not really embryologically a part of the maxilla. The maxilla develops from certain parts in the embryo, and then the septum comes from different parts of the head and neck embryological structures. And if the maxilla doesn't fully grow forward and widthwise, the septum cells are going to still deposit because they're developing independently, and it's going to be deviated, and it's going to obstruct the already small nasal volume. And then the body has to accommodate to breathe, and positioning the head forward, causing all of the tension in the musculature, causing tension in the fascia, because now you have to restructure. You're not meant to be like this. You're not meant to breathe through the mouth. And then the fascia and the muscles have to compensate. So where do we start? Do we start just changing the structure right away? I mean, technically, I look at the structure and like, oh, this all needs to be redone. You need to be expanded. We need to fix your nasal breathing, but where do we start? And more, I'm recognizing that giving them something to reorganize how their muscles work and how their fascia works is super important in how I'm going to change the structure, because they're so interdependent. You can't just separate that. You can't just do one and then try to do the other on top, or you can't do fascia work on top of a patient who already has MARPE. It's very, very difficult. It's sometimes difficult to coordinate them to do the body work first for a good period of time and then do the expansion. So sometimes it ends up that the patient who's already been expanded is going into PRI therapy or myofunctional therapy, and then you get questions, when is this appliance coming out? Which is a great question, because it's preventing them from being able to keep the system mobile and adjust the muscles in such a way that the patient is fully comfortable, because there's something binding to halves of the skull. So ideally, I would want patients to do body work to release whatever tension they can, then expand, use those skills that they had learned, use the breathing skills, rebuild nasal breathing ability, because disuse of the nasal cavity is going to lead to poor nasal breathing. The cells change, the epithelium changes. So nasal disuse is a big contributor to inability to breathe through the nose. They would do so much better with expansion and orthodontics instead of having to wait to do that retraining of the soft tissue after, because it's a big part of the year that is taken out by the appliance. It's usually about 3 months of turning, let's say, and then 6 months of waiting. Let's say on average, it's a long time. That's something that they should be able to use other skills to organize their body.
So just to review your answer, you would start with, after the consultation, you would recommend the body work approximately like maybe 4 sessions, maybe myofunctional therapy, maybe, and on top of it, maybe osteopathy or craniosacral therapy or physical therapy to remove the tension, to balance the posture. And then they start with MARPE.
Right.
And then they learn the new skills, new physical skills for the body, tongue posture, neck posture, nose breathing, muscle strength, and they can incorporate the new skills in a new position. And once MARPE, 6 months of MARPE, let's call it, done, and we start with clear aligner therapy, they can do the full myofunctional therapy training and then full, body work training to put it in the reality.
Yeah, that is I'm adopting this protocol as the protocol because I'm seeing that doing it the other way, I think it's very difficult for the body, and it just really depends on the patient. But more and more, I think we're going to get better results if we address the tension that has resulted from poor structure before we fix the structure.
Thank you. That's such a great answer. But I'm going to ask you some short questions. Okay. Number one question, mandible, maxilla. Let's start with the maxilla. It's not only small usually for people who can breathe through the nose, but it's also backward position. So do you use face mask in your therapy when you do MARPE? Because MARPE can have a little hook to move the maxilla forward.
Yeah, so it depends on the age of the patient. I do use reverse pull techniques, and patients do get better results. I can rotate the occlusal plane more, so we can do other things with it. But when we measure for what happened in adults, statistically, we don't see a significant change in the numbers. We get better smile aesthetics, we get improvement in the biplane position, but the forward orthopedic repositioning of the maxilla is pretty limited in older patients, I would say like over 25. When I measure the before and after on the SEP, on the CBCT, it's not statistically significantly moved forward beyond what the MARPE does itself. So it's not, it doesn't do what you think it would do.
So, but it's a good intention. It's improved the smile. So my second question, which is also very important for people, does this procedure covered by insurance, medical or dental?
Yeah, it's not. So sadly, it is not. And we don't know when they would catch up with us because maxillary expansion in adults and TAG-supported expansion has been around for about 15 years. And it's known to produce multiple benefits like nasal breathing improvement, structural improvement, bite improvement. And it is a medical and a dental procedure. It improves periodontal health. It was initially designed as a periodontally protective procedure because you can, like we discussed before, adequately put the teeth into the arch. There is no separate billing code, medical or dental, for this appliance that I know of patients getting reimbursed, and I haven't heard of anybody successfully getting reimbursed for it, unfortunately.
And my last question, and it's mostly for professionals. If you get MARPE, and it's clear what once you get the space between the front teeth, it can be closed with the clear aligners. But we have another member of this family. We have a bottom jaw. And we both know what this jaw is much harder. It's totally different quality of bone, and it's much harder to work with even in a younger patient. So what's the course of action? If you can give us kind of a strategy from the start, how you work with the jaw, but it's bottom jaw, which is not as obedient as a maxilla or top jaw.
Yeah, mandibles will be mandibles, somebody said. So it's a completely different animal. It's one bone. The midline fuses by the age of 2. We can't just put a couple of mini screws and make it bigger. And we can't, there's not much we can do to it, especially for an adult. So it sits in the joint and it hinges like this, kind of like a mailbox. We can make it rotate upwards and counterclockwise if we push up the upper back teeth. Sometimes in mouth breathing patients, the upper back teeth are down, and that pushes and clockwise rotates the mandible this way. If we push these teeth in, we get that natural counterclockwise rotation that simulates natural growth, but it's not growth. it's repositioning, which can be extremely powerful in opening up the airway and also improving bite and facial aesthetics. The other thing we can do if we need to move the teeth out a bit in the lower arch, we can use a procedure that's called surgically facilitated osteogenic orthodontics, where the periodontist and oral surgeon adds bone around the arch where the roots are, and then we can move the teeth more safely and create a better articulation between the upper and lower jaws.
Thank you very much, Doctor. You gave, difficult topic, but very stylish, very fashionable topic, but you gave very clear answers. And for people who look into these procedures as one of the treatment assortment or treatment choice for sleep apnea, you can find Dr. Sapozhnikov information underneath this interview, and she's also active on Instagram. So we'll put all the information underneath, but you can schedule a consultation and she'll answer your specific question on MARPE and making, more space for the tongue, more space to breathe through the nose, and in general, better health options. Thank you very much.
Thank you, Dr. Sokolina, for having me.